Hey, well, Sondra, thank you for being with us and for participating in the Pride in Healthcare campaign. Why don't we begin with you just telling us a little bit about yourself?
So my name is Sondra, she, her, hers. I am a family nurse practitioner. I practice at Village Medical at one of our downtown locations on East Street. I joined the practice originally when it was Chatham Care about 3 years ago. It was just Dr. Blackwell and myself. And then about a year ago, we joined Village Medical. I started out with getting my bachelor's in nursing at IUPUI here in Indianapolis. I then worked for IU Health in the ICU and surgery recovery for a few years while I went back to school to get my master's to become a family nurse practitioner at the University of Indianapolis. And I was fortunate enough to get to do my clinical rotations at Chatham Care with Dr. Blackwell, and then joined the practice immediately after graduating, which is kind of something that I had hoped would happen for years while I was training with him, and then it did work out. It did get to happen. So I was very fortunate to get to start my career exactly where I wanted to be.
Amazing. Congratulations. I feel like often there is a little bit of a journey to get where you want to be, right?
Yes. It's not always like getting to start right with your wish list, but I got very lucky where I got my first choice right away.
Yeah. So tell us a little bit more about that and how you just got interested in healthcare overall.
Well, I knew I was interested in something in the STEM field, something healthcare. Started kind of working my way through college and wasn't sure if I wanted to do something patient-facing or something more like environmental health. As I started kind of going through classes, doing internships and studying abroad, kind of realized I really enjoy the one-on-one patient interaction and patient education. It's something that never gets old, and it's so fun because if you can tell someone the reason why you want to do a screening or why you're choosing a treatment plan, it helps everyone get on the same page and sometimes can help unveil different questions so that we are going towards the same goal together. And I originally started learning a little bit more about doing gender affirming care when I was working as a nurse. There was a transgender healthcare conference at the University of Indianapolis, and I didn't really know what the conference would entail, but fortunately they had a student discount, and so I thought, like, sure, I'll go. Like, I feel like if I don't really know what the conference will cover, it means I clearly have a knowledge gap here. And so went to the conference and really started learning about how there is a gap in care and there aren't enough providers who know how to provide affirming care. And that's where I started just kind of wanting to dive in and learn a little bit more and a little bit more. And it kind of ended up becoming the focus of my career.
Amazing. Yeah, I think that's really, really just honorable of you just to even have that thought process. Like, well, let me go learn more, right? I feel like often that is not something that most folks would do. So I think this is a good segue too into that, that realm of how did you hear about OutCare Health and what made you join the OutList to begin with, given, this whole background of yours?
Yeah. So I'm a big fan of conferences, and I was at the IU Health LGBTQ conference and learned about OutCare. And so then I logged onto the website and realized, oh wow, this is like an untapped resource that I didn't know about. And then I started doing the training to become certified, and then started having some of our staff do the certification as well, so that we all were kind of mindful of, okay, are we doing everything we can to create an inclusive environment? What are we doing well? What can we change to do even better? So that we can ensure that we are creating a place that is welcoming for everyone and creating a safe space for patients as well, and having that balance. So I learned about care through a conference and joined the list right away. And I believe when I joined, I was still, I wasn't a family nurse practitioner yet, so I was a nurse. And so I had to leave my listing, like originally as like I'm a nurse in the hospital. It's like, I am one of 800. Maybe you'll see me, maybe you won't. And then once I graduated, I was like, oh, okay, now I'm easier to find. It made it a little bit easier.
Talk to us a little bit about that and how now folks are just finding you all the time, right? And what have the interactions with patients been like, especially for those who have found you on the OutList?
After graduating, that was something that was top of mind, of making it easier for patients to be able to find access to care. Because previously we didn't always do the informed consent model for gender affirming care. So then sometimes patients were having to do like 2 layers of research. One, finding someone who knows how to do gender affirming care, and then the second layer of finding someone who does the informed consent model so that they don't have to also meet with a therapist, and just for being able to be easily identifiable to patients in the LGBTQ community, of knowing where can I go for primary care and know that I'm not going to have to explain what PrEP is, and that whenever I talk about my wife, someone's not going to ask about birth control at the same time and not understand and have all these extra follow-up questions, because it really shouldn't be something that is unique. We should, as providers, just be informed and get a thorough history for our patients and make sure that we're asking the questions and providing good quality care that everyone deserves.
I love that you say that, because you said you've done the training and you've encouraged other folks to also take OutCare's training. So talk to me a little bit about how you all create a welcoming environment and inclusive space for your patients.
Yeah, so something that I do within the office is anytime a new staff member joins our team, whether they're working in the front or they're one of our medical assistants in the back with us, I have a one-on-one session where we just talk about how to create an inclusive environment and how to phrase questions and different types of terminology that patients may use, and what's a respectful term, what's not a respectful term. We kind of go through the do's and don'ts of communication, and then we also cover what all do we need to do to provide inclusive care whenever it comes to screenings, whenever it comes to ensuring they have access to resources for things like gender marker change, legal name change. What are those community resources as well? And kind of teaching them, okay, what do we do here? And what do we have available to us within the community? Because you don't have to know how to do everything, but you just need to know where to point someone in the right direction. And so we get to meet one-on-one. And I really enjoy that time, because I, over time, have learned a lot from our staff members as well, where they teach me different community resources too, where it's like, oh, I didn't even know that existed. And so it's like, great, add that to the list. And so it's kind of fun where it's like, over time, I have this kind of like rolling Google Doc that I share with anytime I get like a nurse practitioner student or any staff members. The document just keeps growing. And so it's like, oh, good. The resource is getting more in-depth and more thorough. So we have a nice little packet to work from.
I love that. That's really powerful, because I think as a patient, if I was to come in and my provider already had this all ready to go, I would just be blown away. So that's excellent. I'm glad you all do that. And I think sometimes you can get stuck in this. You're so busy, right? And I don't have time to go take another training course or go to another conference. Talk to us a little bit how you keep yourself up to date on education or work closely with colleagues to give them up-to-date LGBTQ plus education and knowledge.
Yeah, and that is something that can be an ongoing challenge, is staying up to date. And I think part of it, something that is helpful to me, is that I still am excited to learn more. And then my colleagues are as well. And so I know that sometimes if I get to go to a conference, but Dr. Blackwell doesn't, he's always excited to learn what I learned. So I'm always taking notes so that when I come back, I'm like, oh, okay, so I learned that there's a better way to phrase this, or there's these other questions that we can ask that can help with prior authorizations. And so keeping that excitement alive within myself and within the office is really helpful and motivating. And I know my patients enjoy it too. So keeping in mind the payoff of doing the extra time to get that extra education really keeps me motivated to keep going. And I find that planning ahead helps me get there. So when I see a conference, even though sometimes it's 6 months out, it's like, whatever, I'm just putting it on the calendar, because if I don't, it may not work later. And so just setting aside the time in advance helps. And I'm also starting to find that I'm starting to use social media more with like my professional account of following fellow providers that are in the area, and sometimes they're sharing resources. And that's really helpful too, because sometimes there are things that I know of, but don't know quite the right way to share it. And it's like seeing examples. It's like, yes, that's perfect. And we can learn from each other. And I find that having nurse practitioner students is also a really helpful resource, where they teach me a lot too. Because, they're very in the mix of the guidelines and what's updated. And sometimes there's a little bit of a delay of getting those changes into practice. And so having those students really helps me stay up to date.
Absolutely. And I feel like you may have already answered my next question, which is excellent. But just if you want to add anything additional, for providers who are listening right now, what would you say to them? What should they be doing right now to continue to keep themselves up to date on, knowledge, skills, strategies?
Yeah, so there's a variety of ways that you can do it. And it kind of depends on what works best for you. And I think it's really important to be honest with yourself of what form of learning do you enjoy and what sticks the most. So if you're someone that enjoys it in kind of a more piecemeal manner, then doing like the webinar sessions where sometimes it's only an hour or less. Or if you enjoy being able to, listen to a podcast while you're working in the yard, something that kind of ties things together. So starting out with, okay, how much time do I have available? When can I integrate this? And then remembering what helps me retain that information. If you're someone that enjoys being able to connect with colleagues, conferences are a great tool. I know whenever I've gone to conferences in the past, it's been really helpful. One of the past ones I went to, I met a fellow nurse practitioner from Northern Indiana who does gender affirming care. And we were talking about diagnosis codes and how to get things covered by insurance. And some of these things you just don't know until someone else passes it along. And then also reaching out beyond kind of your immediate community. So I'm a member of the World Professional Association of Transgender Health. And I've met a lot of providers on there, and connecting with them in the process of getting my certification with WPATH has been a really helpful tool, because there are some people who are very research oriented, and so they will just pass along excellent articles as they come. And so it's fabulous, because then you already have someone who's kind of doing that pre-filter for you, and then just pass along. It's like, ooh, great, I haven't seen this one. So it makes it really wonderful. So just connecting with colleagues that also are interested in providing LGBTQ plus care can be really helpful, because they can also share what resources have worked well for them.
Oh, that's excellent advice. And I think it's always a little less daunting when you have support from fellow providers and community members who not only they want to learn, but they want you to learn as well. So that's amazing.
Yes.
Found that community. In that same regard, put yourself back into the, your younger self, your old shoes, going through the process to get certified. And what advice would you have for, a learner currently going through the process, or even a provider who's just starting out fresh out of, residency?
Yeah, so excellent resource would be looking at OutList and looking for providers, and then reaching out to ask if you can shadow to see if you can do a clinical rotation. Sometimes even just a few hours of shadowing, you can learn so much from a provider. And I will say that every provider that I've met that focuses on ensuring that they are providing inclusive LGBTQ plus care, they are so happy and excited to share, because the whole reason why we focus on this is because we don't want this to be a unique thing. We want this to be the standard. And so the more people that we have educated and prepared and mindful of just unique needs of different patient populations, the more the merrier, because that can help with each person kind of teaches someone else little tidbits. So that as a whole, all healthcare providers know a little more and can help. So starting to reach out, and providers are happy to help. Who doesn't love kind of sharing what you know? And sometimes whenever you do teach someone else, you kind of realize, okay, maybe I know a little more than I thought, because sometimes we think, oh, I still have so much to learn, and we always do, and we always will. But, you know, reflecting back at where you started from sometimes helps you realize, okay, I do have something to share here.
No, I love that. It's a journey, right?
Yes, yes.
And sometimes it takes a village, right, to get you there. But it is always good to reflect and see where, you know, where your mind is and what you have even taken in with all your surroundings. And then we, you know, have this campaign going, right? Pride in Healthcare. So tell us a little bit more about what pride means to you, or even pride in healthcare, given your interaction with so many LGBTQ plus patients.
Yeah, whenever I think about pride in healthcare, I think about, you know, this is a time to celebrate how far we've come in terms of research being more inclusive, in terms of providers being more knowledgeable, and also a time to kind of live in the moment of celebrating the positive influences that we have within the community, the things that we do have that are going well, and then also a chance to look at those resources in our community and figure out, how do we work together to make even more progress, because we have a long ways to go. And you know, especially in different states, here in Indiana, we have a long ways to go to improve care, and to make it more accessible for all, and to remove barriers. And so this is a great time for us to connect with others and find ways to work together to make those improvements, so that each year the celebration can be even more progress and helping more people feel loved and cared for.
Absolutely. And given that you are on the OutList and you have interacted with OutCare, why are you proud to do so?
I am proud to be on the OutCare list because something that you know, I've spent time doing in the past you know, years of my career has been, how do I ensure that I am providing inclusive care and the best care I can, and being able to see patients' feedback of what is going well, what is hitting that goal, and what I sometimes worry I'm not doing well enough on sometimes isn't what matters to the patient, or isn't what stands out to them. And so being able to see patients' feedback is really helpful. I really enjoy being able to see what matters to patients and what their perspective was on our interaction. I often find myself getting a little bit teary-eyed when I read reviews, because sometimes, like you said, you kind of get in the thick of it and you get so focused on, okay, I want to make sure I do a thorough assessment, that I know what resources you have. You know, I'm kind of going through my checklist, and then I forget about, this is a really big day. You know, patients being able to come in and chat, and being able to come in and they may feel a little bit nervous or anxious, and then walk away and it went smoother than what they expected. And it's like, okay, it's actually working. All right, we're doing it. You know, the goal is actually being achieved. And so that is something that is so helpful and rewarding with the OutList, is being able to have kind of a temperature check on, am I doing what I'm intending to do?
No, that's beautiful, and you have a lot of reviews, so I will say congratulations on that front. And
Thank you.
It's always exciting for me as well to see them come in, but also when folks leave feedback on our website about just the different programs that we offer, it's always just delightful. So I resonate with what you're saying pretty closely. And on that note, is there anything else you want to share with us and the folks that are listening?
I just want to share that I'm grateful to be a part of this community and to be able to help provide care to patients. And I look forward to meeting many new faces along the way. And happy Pride, everyone!